This is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
Hi, all you lovely ladies. Are you pregnant with baby number 2? Well, congrats. Pregnancy Pukeology Podcast, episode 15, your second pregnancy symptoms and what you were not expecting is absolutely perfect for you. Want no more morning sickness, pregnancy nausea, or how about no more second trimester headaches and migraines? Visit our sponsor, nomonausea.com. The only natural way to instantly stop your worst nausea, vomiting, or headaches now. Or just place your No More Nausea band on your baby registry for your delivery bag at Bye Bye Baby, Amazon, or Walmart.com. And your little ones are always taken care of first with No More Nausea Kids at your local CVS store. Pregnancy humor in this podcast may just want to make you pee your pants, like you don't already have to pee all the time anyway, with hilarious stories like blew my Cheerios, tea and pee, bush please. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know that we're in this together. 3 takeaways that you'll learn is the science behind your bodily changes and what to expect the second time around being pregnant. How you can help yourself out with some great tips to make this pregnancy the best one yet.
The science of puke, Pukeology.
Deliveries are kind of like babies. They come from the same place, but they're all different. Your mind and your body, however, will go through severe and very challenging mental and physiological changes that have already happened to your body the first time when you were pregnant before. Like most of us, we had a birth plan, and that went completely outside the window after delivering your first child. Well, the second one, you learn to be a little bit more adaptable, ready for change, because we learned after the first one, anything can happen. How do you feel about being pregnant? Well, that'll probably be different. Since you already have one child that you're chasing around, you probably feel more tired since you have no time to nap. Your belly, it will pop faster because your body has muscle memory and stretches easier. The good news is that there's less round ligament pain that you may have or have not experienced in your first trimester, but you're still going to pee like a racehorse, I promise. If you want to know more about why you keep running randomly to the bathroom, check out Pregnancy Pukeology episode 11, and you'll recognize kind of why it is and what hormones are responsible for you having to pee in all 3 of your semesters. You will also get to have that internal bond and connection with your baby a lot sooner. This communication, by that I mean you'll probably feel the baby kick sooner, usually right around the 4th month. But second-time moms are also more likely to have Braxton Hicks contractions a lot earlier than they did on their first. So you get a positive baby kicking and a negative you kicking yourself in the belly. Physiologically, the hormones produced by your body generally come in excess because with the second one, just like muscle memory that we talked about before, it's been through it. Hormones like relaxin, which help to open up the pelvis. Prolactin, which helps to increase the amount of breast milk that you have. So yay, make sure that you try to breastfeed if you weren't successful on your first. And oxytocin, which makes you happy. It's that happy hormone that makes you love and cherish the baby with every single smell. So if you did suffer from mild postpartum depression, again, you actually have a decreased chance of having it on your second time around. Well, there are other conditions that will or predispose you to having the probability of having more of, such as cardiac abnormalities, mainly mitral valve prolapse. It's basically think of it like a door frame and the actual door. So it's when the frame itself starts to bow in your heart, and that's the valve or the checkpoint, I guess you could say, from one atrium to another. So as the blood flows, it tends to bulge it and push it out more frequently, hence giving mild chest pain, and also the ability, a lot of women sometimes feel very lightheaded. So you definitely want to go see your cardiologist if you're having any of those weird symptoms. It's also more likely to happen with a second child because as you increase the amount of fluids, your body naturally tends to hold water. And so this edematous or, increased amount of fluid that you have puts a lot more pressure on the heart. So think of it like a parachute. When it's under even more stressful conditions on the subsequent pregnancies, it's not going to work like the first time. It's not going to be as crisp. It's going to be much more mobile. Yes, ladies, you might have more aches and pains. Sorry to be the bearer of bad news, especially if you didn't have those abdominal muscles back in check. I know me personally, I still kept 10 extra beautiful pounds of curves with every single one. And the reason why I say that if you didn't get your abdominal muscles back in shape after your last delivery, that actually increases the risk that you might have back pain with these subsequent pregnancies. I also hate to state this out loud, but you have an increased chance of varicose veins. Those are those ugly things that get on the side of your thighs or calves that basically start to bulge out. You can really see your veins if you do have varicose veins. And they usually are worse after baby number 1 due to excess pulling of blood and the fact that you start showing earlier. So it puts more weight, more strain, things like that on the lower extremities of your body. Make sure you try to make exercise part of your daily routine. That'll actually really help to get that blood flow and the fluids actually moving. Speaking of muscles, the vaginal canal, which is a large band of muscles, does have muscle memory. So if you're having a second vaginal delivery, your body will be able to kick into action and move the child down through the birth canal quicker. Cervical changes usually happen twice as fast as they did with the primary delivery. Usually we estimate 1 centimeter per hour on your first pregnancy, and then half that amount of time for your second. So, labor during your first time pregnancy, about 8 hours, and about 5 hours for your next pregnancy. This means the second stage of labor, which is the actual pushing and birth phase, is under 2 hours with the second baby. Yay! You get to see your baby sooner than you did with the first. After birth, or I should say the cramping feeling that you have when your uterus is trying to shrink back to size. So that is considered the third stage of labor, is delivering that after birth, or your big uterus, is much more intense. Imagine that your uterus is kind of like a balloon. The first time it was nice and tight and it shrank back to size when it was deflated. But the second time, just like you blow up a balloon, the air comes out and it doesn't return back to its original size unless forced. And so you've seen that if you've ever blown up a balloon once or blown it up twice, it blows up twice easier, but it doesn't return back to its same size even when you let all the air out. Most of these women with second-time pregnancies will have to contract stronger and will probably have Pitocin hung a little bit longer after baby number 2. So tell them to not pull your epidural very quickly. Leave it in there so that you don't necessarily feel those contractions for the afterbirth. An anticipated side effect or complication, like whether or not the baby becomes distressed during delivery or causing an emergency C-section or having nausea and vomiting during delivery, is a case-by-case basis. So there's no real evidence and no real studies that have correlated between first pregnancy and second pregnancy. I do know that 80% of women, however, do experience the number one side effect, nausea and vomiting during their delivery. But luckily, there are natural solutions to keep you and your baby safe called the No More Nausea Band. So go visit them on nomonausea.com, or you might see them in the delivery room in your hospitals. But if you don't, go pick one up just to be sure at Bye Bye Baby and No More Nausea Kids. It's great for car sickness and stuff like that, and can help by getting it from CVS to alleviate those common complications with your second pregnancy without medication.
Throwing up on a Tuesday? One puke story.
I was pregnant again, but not big enough for others to know. I had a screaming toddler in the aisle with me at the grocery store, who all he wanted was a Cheerio toy that was hanging down the aisles. I bent over to grab the bargain bin bag cereal that looks like Cheerios, and I gave the bag all the toppings that it could possibly need. Yeah, that's right. I threw up all over the cereal while my son was having a tantrum and running away from me. I kept puking, chasing him down the aisle. I basically gave up going to the supermarket completely with baby number 2 after this horrible incident, and I love shopping online. Thanks, Mari, for your hilarious puke story. I will definitely never look at Cheerios the exact same way. My hubby used to show me his love by making me morning sickness tea. Every morning that I was pregnant with the first. But by the time I got to the second baby, I asked him if I could just have 30 minutes of quiet time while drinking it so he could take care of the baby. One morning, I spilled the water, and all of a sudden, the smell of the burnt water made me start throwing up into my pot of tea. The dry heaving made me start peeing. While my husband rounded the corner, he saw me in a pile of puke and pee, and he now stays out of the kitchen during my morning routines. Deirdre, thank you so much for making us laugh, and I can just imagine the look on your husband's face. First pregnancy, I ate as healthy as humanly possible. And with the second pregnancy, I was like, gee, I could really go for sushi and a cold cut sandwich right now. Both things you're not supposed to do. After having both pregnancy forbidden foods in my mouth, my body repelled them as fast as I put them in. There was nowhere to go, so I threw up in a fake oriental plant that was next to me at this Chinese restaurant. As a quiet restaurant it was, everyone stared at me once I sat back up. The worst is that I kept eating and cleaned nothing up. Thank you, Sandra, for your hilarious puke story. Oh my gosh, Chinese food, I'm sure, doesn't taste the same coming back up as it did going back down.
Tips and tricks to stop the up chuckle that you need.
Pregnancy knowledge is the feeling of knowing nothing with the first and way too much with the second, hence why you're listening to me right now. I talk more about this and emotional intelligence on We Go Kids TV series and podcast. Check out parenttalk.tv or on YouTube on We Go Kids. The interview with Dr. Jacqueline Darna, and you actually get to see my face too and not just hear my voice. So I'll let you in about the truth of second pregnancies, both in the negatives, bigger belly, exhaustion, back pain, varicose veins, Braxton Hicks contractions, and the positives, always ending on a positive, of course, feeling the baby kick for the first time faster, and a shorter labor. Woo! Here is some advice on how you can make the most of your second pregnancy. These tips are amazing, so get out a pen and paper and honestly write them down or listen and back this one up a few times. Childbearing and child rearing takes a tribe. Don't be embarrassed to ask friends and family to take your first child so you can have an hour to yourself. Don't you dare do chores or clean. Instead, do what you want to do. Spend the day at the spa, reading a book, swimming, napping, because you truly need a little relaxation to feel rejuvenated and combat against this feeling of complete and utter exhaustion. Use a belly band. It's a support band that helps to hold up the baby. This will not only help your back, but will also keep your tummy muscles tighter. Now, these bands, for all my Latin ladies like myself, are called fajas. I'm sure you've heard of them to get that beautiful hourglass figure, but they're also great for getting your postpartum body back to normal. Throw that on under baggy clothes after you have the baby, and you and yourself, especially even if you had a C-section, it will help you to basically heal those muscles faster because you're not putting the stress and strain of constantly working them all day. Since breastfeeding is actually statistically easier the second time around because you'll have more milk production, give it a shot. I know me personally, my first one didn't know what the heck to do, but my second one was like a Hoover vacuum, and I'm so glad that I didn't give up. Don't forget to bring with you to your actual hospital stay that breastfeeding pillow, a nipple shield if your nipples are inverted, or if your baby didn't latch very well on the first one, try a nipple shield. I know it saved me in my breastfeeding experience with the first child. Bring breast pads or a milk catcher. I love this thing called Milk Savers. It's basically like where you put your nipple inside of a hole and it catches all that beautiful golden milk. And especially when you're creating that colostrum, it has the highest amount of antioxidants, and it also gives the baby the ability to be able to fight any type of infections. That's the reason why these wonderful additives to your breast milk naturally will actually help them to fight off and ward any type of outside infection. But that's also why you have to breastfeed every 2 hours. If not, it doesn't work as well. Did you know that listening to soothing music actually increases the amount of breast milk? One study suggested that moms pumping with preemie babies actually made 120% more milk while listening to music. So give it a go. Listen to that Beethoven or whatever you want to listen to. Make sure that it's nice and smoothing and make more milk. I cannot stress enough the importance of exercise. Circulating the blood and the excess fluid pregnant women accumulate during pregnancy to avoid the swelling in the feet and other types of edema. Exercise will help you have less varicose veins. Oh, so now you're listening about the varicose veins. All right, wear those Ted hose, or at least wear those knee-high athletic socks, and always put your feet up when you're resting to avoid those ugly veins that you don't want after birth. Swimming or other low-impact exercise routines are great, especially since pregnancy hormones can cause all the ligaments to stretch, so injury is more common, and you know that you're not supposed to pick up anything more than 20 pounds during your first trimester to avoid miscarriage. Other things that you may want to consider, if you are taking any type of yoga classes, remember in your third trimester, never lie flat on your back. It will compress both the artery and the vein. You will not only feel very lightheaded, but also your big belly will cause you to not be giving adequate blood flow to the baby. So make sure that we call it left uterine displacement. Basically, shift everything over by placing a little wedge underneath of you while you're working out or doing yoga. Another muscle that is usually ignored is your Kegel muscles. It's your bounce, chicka, wow, wow, your sex muscles. So squeezing this muscle while you're in the car every day is actually amazing. And so just in case you don't know what I'm talking about, it's the muscle that makes you stop peeing once you've already started. And it helps to keep the vaginal muscles super tight for the aftermath of once you're done with the baby itself. Do Kegels every day. And it's an added bonus because it's actually been scientifically proven that it makes you horny. So your hubby will totally thank me. You're welcome. What about a birth plan? What birth plan, I should probably say. I always think it is so cute when first-time moms have a birth plan. I always ask, so how did it go? And they always say it never goes as planned. Second-time moms are more understanding of that. 1 out of 3 pregnancies, unfortunately, end up in C-section. But I say unfortunately, but it's not. It's for the protection of you and your baby. And because of that, a lot of us need to remember that vaginal births don't always happen. I am a perfect example. Had an emergency C-section with my second after having the most incredible, easy vaginal birth with my first. So you never know what rounds the corner. But always make sure to have your no more nausea band in your bag, because nausea and vomiting during delivery, especially due to C-sections, happens. And the reason why is because after the spinal or epidural placement, it is the most common complication. And it's actually due to a drop in your blood pressure, which your anesthesia provider will actually fix that. But at least it can avoid you puking your guts out all over you and your darling husband who are sitting next to you. So again, just keep it. It's on your wrist. It's operating room safe. Throw it on, smell it whenever you need it, and it'll help to avoid all of those terrible side effects because of its peppermint aromatherapy infused acupressure wristband. The delivery experience is as unique with each child as your baby's personality will take on. For more information on your journey, keep listening to us and more of the Pregnancy Pukeology podcast episodes, starring me, the doctor next door, Dr. Pukenemo. And ladies, remember, you got this, because you did it again, and you can do it all over. May you all have safe deliveries. If you love Pukeology podcast, tell somebody. Let us know with a 5-star rating or hearts for likes. Don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks for listening to Pregnancy Pukeology Podcast, Episode 15, Second Pregnancy Symptoms and What You Totally Did Not Expect.
Pukeology Podcast, edutainment at its finest.